mobilization of the pectoralis major muscle. So we can see and study the structures beneath these two large muscles. No? The inferior border, inferior and lateral margins of the muscles were clearly delineated, no? And the deep fascia was cut, no? And the muscles were detached, no? From their sternal attachment and from their attachment to the ribs, no? So at this end of your pectoralis major muscle, you have the aponeurosis, no, of the muscle. So the aponeurosis was cut and detached, no, from its sternal and from its chest wall attachment. No? Then the muscle was carefully lifted. So what lies below the pectoralis major muscle? We have the pectoralis minor. On this side, on the right side, the pectoralis minor has been mobilized as well. No? But on the other side, no, the muscle is still attached to the chest wall. So if you look at this area closely, you have some neurovascular structures in there. No? So the main arterial trunk, no? Though this is not yet very well dissected, the main arterial trunk, no? And that is part of this neurovascular bundle, no? Would be the thoracoacromial trunk. No? The thoracoacromial trunk arises from the axillary artery. So it will have branches, no? It will have branches going to the muscles and other soft tissue structures here, not only in the anterior chest, but also going to the shoulders. No? So the artery, no, the trunk and its branches have their venae committantes. No? And then for the nerves, no? The nerves that are arising here, no? Let's move on the other side. No? We have the lateral pectoral nerve here. It passes right above the pectoralis minor, and we have the median pectoral nerve here. The nerve actually pierces, no, the pectoralis minor muscle. So if you look at the position, lateral pectoral, medial pectoral nerve, no? So the medial nerve looks more lateral in position compared to the lateral nerve, which looks which appears to have a more median position. These nerves are not the terms lateral and medial actually does not apply, no, to their position as you can see them right here. No? This is called the lateral pectoral nerve because it arises from the lateral cord of the brachial plexus. No? Then this one is it is called the median pectoral nerve because it arises from the medial cord of the brachial plexus. So their gross position, no, here is not related in any way, no, to how the nerves were named. So with the pectoralis minor muscle, no, mobilized and reflected laterally, no, we can now see the ribs, the costal cartilages. So again, this will be the second rib and the second costal cartilage, and they are at the level of the sternal angle. Eponym for sternal angle, we also call this as the angle of Louis. Then you have the intercostal spaces right there. You can see intercostal soft tissues, no, and muscles, no. So there are 3 layers of muscles, no, in the intercostal spaces. External intercostal,